My dear students, Assalamu alaikum. We were reading about the renal biochemistry. Today we shall discuss a very important topic both for the SAQ and oral examination. This is very vital topic. So let's start the topic um, which is termed as glomerular filtration rate. By definition, glomerular filtration rate is the quantity of glomerular filtration formed per minute in all the functioning nephrons of both kidneys is called glomerular filtration rate. That is per minute. First point is per minute, and it is to be by the all the functioning nephrons. If one nephron is not active, then we will not count it. But all the nephrons which are in form, in action, in perfect for both the kidneys, then we will say that the glomerular filtration is the quantity of glomerular filtration formed per minute by all the functioning nephrons of both the kidneys. This is termed as glomerular filtration rate. So you must remember 2 points. One is all the functioning nephrons, second is both the kidneys, third is per minute. These 3 points. Not that you need not to remember the uh, uh, definition as a whole, but you have to remember 3 points. One is that uh, all the functioning nephrons of both the kidneys and per minute. It is about 25 milliliter per minute or 180 liter per day. This figure you have to remember lifelong till you are in the medical profession. It is often asked in the examination. So glomerular filtration rate is about 125 milliliter per minute or 180 liter per day. In female, it is 10% less than the male. In female, it is 10% less than the male. Now, how this filtration occurs? Nothing occurs in response to filtration. There is to be pressure difference. As you have seen in my last lecture that there is an afferent arteriole comes to the glomerulus, then there is formation of tuft of glomerulus which is termed as glomerulus, then it again forms the efferent arteriole which it goes out, and that the glomerulus is encapsulated by Bowman's capsule. So when the blood flows into the glomerulus, there is a hydrostatic pressure within the glomerulus which is equivalent to 60 millimeter of mercury. As you also know that in the blood there are proteins, colloidal substance, which wants to keep the water inside the blood vessels. So this pressure will try to maintain the fluid within the blood vessel. So one is the hydrostatic pressure, which 60 millimeter of mercury, and another is the glomerular colloidal osmotic pressure, which tends to maintain it within the glomerulus, that is about 32 millimeter of mercury. Again, there is Bowman's capsular pressure. Bowman's capsular pressure, which is about 18 millimeter of mercury. So only one pressure tries to push the filtration within the Bowman's capsules subsequently to the proximal convoluted tubule, that is the glomerular hydrostatic pressure, which is equivalent to 60 millimeter of mercury. And two pressures, one is the one wants to remain within the blood vessel, that is the colloidal osmotic pressure, which is about 32 millimeter of mercury, and Bowman's capsule pressure, which is 18 millimeter mercury. That is, these two aggregate is the 50 millimeter of mercury, which tries to maintain the fluid within the glomerular capillaries. But as the glomerular hydrostatic pressure is 60 millimeter of mercury, so the net glomerular filtration pressure becomes 10 millimeter of mercury, due to which the fluid passes from the glomerulus through the Bowman's capsule into the proximal tubule. This is the glomerular filtration process by which it enters, the fluid enters, the filtrate enters into the proximal convoluted tubule. Now, what are the factors that affects the glomerular filtration rate? The question in the professional examination in SAQ is define glomerular filtration rate and write in short about the factors affecting glomerular filtration rate. This is the question, and this is invariably comes in the professional, either in the SAQ or in the oral examination. So number one is the net filtration pressure at glomerular membrane. Net filtration pressure, as I told you, there is the 10 millimeter of mercury is the net filtration pressure. If this is okay, then the glomerular filtration will be normal. This depends on hydrostatic pressure in glomerular capillary. If it is normal, then it will be you will get the normal GFR. Again, hydrostatic pressure in Bowman's capsule, if normal, you will also get the normal result. Subsequently, colloidal osmotic pressure in glomerular membrane also small. So these are the three fundamentals. One is hydrostatic pressure in glomerular capillary, one is hydrostatic pressure in Bowman's capsule, thirdly colloidal osmotic pressure in glomerular membrane. Now, if we elaborate, that is the if glomerular hydrostatic pressure increases due to any reason, then GFR will increase, and if there is decrease in glomerular hydrostatic pressure, then the glomerular filtration rate will decrease. Again, glomerular hydrostatic pressure, this glomerular hydrostatic pressure again depends on three things. These are arterial pressure, afferent arteriolar resistance, and efferent arteriolar resistance. One thing is this, initially we are telling if the hydrostatic pressure is normal, everything is normal. If it is raised, then the GFR is raised. If it is decreased, GFR is decreased. Now, what are the factors on which the hydrostatic pressure depends? Hydrostatic pressure depends on the arterial pressure, afferent arteriolar resistance, and efferent arteriolar resistance. Increased arterial pressure increased GFR. As I have told it that the increased arterial pressure will increase GFR. increase afferent arterial resistance. Increase afferent resistance. If there is constriction in the afferent arteriole, then there will be decrease in GFR. Constriction of efferent arterioles affects perseverity. In respect to efferent arterioles, then the GFR will depend on the severity of the constriction of the efferent arteriole. Not that like efferent arteriole, if there is constriction, if there is resistance, that the GFR will be decreased. But in case of efferent arteriole, it will depend upon the severity of the constriction. You have to understand that the severity, it may be moderate, it may be severe constriction, moderate constriction or severe constriction. In case of moderate constriction, afferent arterial flow is okay, and there will be more accumulation of fluid or blood in the glomerulus, so it will not be able to pass easily into the or through the efferent arteriole. Rather, it will create more hydrostatic pressure in the glomerulus, which will ultimately lead to GFR increase as the hydrostatic pressure in the glomerulus is increased. This is one thing. Again, if there is severe constriction, in that case the flow, there will be backflow, and the afferent arteriole will not be able to pass more blood or fluid into the glomerulus. So in that case, there will be reduce of GFR. You have to understand these two things. These two things is a bit complicated. In case of moderate constriction of efferent arteriole, it will increase the GFR, and in case of severe constriction, it will decrease the GFR. Increased glomerular capillary colloidal osmotic pressure decreases GFR. It's quite natural that if the colloidal pressure, if the colloidal substance is more in the glomerulus, then the GFR will be less, and if the colloidal osmotic pressure is increased in GFR, colloidal osmotic pressure decreases, it will increase the GFR. There is the increased glomerular capillary colloid osmotic pressure will decrease GFR. Conversely, decreased glomerular capillary colloid osmotic pressure will increase GFR. There is the colloidal osmotic pressure will want to keep the fluid within the glomerulus. So if there is increase of colloidal substance, colloidal pressure in the glomerulus, there will be decrease of GFR. Again, if there is decrease in colloidal osmotic pressure, then there will be increase GFR. It is just reverse. If the colloidal osmotic pressure is more, GFR will be less. If the colloidal osmotic pressure is more, colloidal osmotic pressure is less, GFR will be more. Increased Bowman's capsule hydrostatic pressure decreases GFR. It is quite natural that if the Bowman's capsule pressure is more, then the fluid will not be able to easily pass into the proximal tube, so the GFR will be decreases. So these are some elaboration regarding the net filtration pressure at glomerular membrane. So these three fundamental things: one is hydrostatic pressure in glomerular capillary, one is hydrostatic pressure in Bowman's capsule, another is colloidal osmotic pressure in glomerular membrane. The explanation as I have given, if you go through the books and listen to my lecture, and it will be, I hope, clear. Now, second point is permeability coefficient of glomerular membrane. It depends on surface area of glomerular membrane. Surface area of glomerular membrane. GFR directly proportional. If surface area is more, GFR is more. If surface area is less, GFR will be less. Number of water pores per unit area of glomerular membrane, also GFR directly proportional. If there is water pores is more per unit area, then the GFR will increase, GFR will be more, and if there is less in number water pores per unit area of glomerular membrane, then it will be less, GFR will be less. Next is the sympathetic nervous system. In respect to sympathetic nervous system, stimulation of sympathetic nervous system decreases GFR due to renal vasoconstriction. Due to renal vasoconstriction, there will be decrease in GFR. It is due to the sympathetic nervous system in stimulation. And reversely, inhibition of sympathetic nervous system increases GFR due to renal vasodilation. Some hormones and autocoid. Autocoid, there is the substitutes for hormones. What are those? These are like norepinephrine, epinephrine, endothelin. Some hormones and autocoid constrict afferent and efferent arterioles, causing reduction in GFR and renal blood flow. So these are about the hormones and autocoid. Again, endothelial derived nitric oxide and prostaglandin decrease renal vascular resistance and increase GFR. Urinary tract obstruction increase plasma protein, renal disease, diabetes mellitus, hypertension. These all things decreases GFR. Now comes to the last one, renal blood flow. Increased renal blood flow increases GFR. Renal vasoconstriction decrease GFR, and renal vasodilators increase GFR. So in respect to renal blood flow, increased renal blood flow increase GFR. Renal vasodilators it will increase GFR, and renal vasoconstriction it will decrease GFR. So the main headlines are, initially you have to remember about the factors that the glomerular membrane, net filtration pressure of glomerular membrane, then the your permeability coefficient of glomerular membrane, and sympathetic nervous system. In addition, to get good marks, you can remember the hormones and autocoid which constrict afferent and efferent arterioles, and the urinary tract obstruction, diabetes mellitus, renal diseases, hypertension. This decreases GFR, and finally renal blood flow, which increased renal blood flow increases the GFR. Renal vasodilators will increase GFR, and renal vasoconstriction will decrease GFR. So these things, one is the definition and another is the factors, is very important. You must understand it properly for getting good marks and answering it properly. And this much today. Next day we'll go some definitions, and before that I will advise you to get through the GFR properly because it is most important in respect to renal biochemistry. Thank you all. Allah Hafiz.